For more, Dr. Glatter joins me. He is an emergency room physician at Lenox Hill Hospital here in New York City. Dr. Glatter, welcome. Thank you so much for being with us. We are seeing the number of new cases level off, but they are still quite high. So what do we need to ultimately do to turn the tide in this pandemic?
I think the public messaging really has to talk about, the bigger picture. And we're talking about having children, having people in high school, people in college really realize how serious this virus is and really to, wear a mask, keep your distance, and always, basically understand how serious this coronavirus is. We're talking about people dying, devastation in intensive care units, emergency departments. I think that all children above the age of 2 need to wear masks. I think that parents need to realize this and that they can even serve as vectors for transmission in the community. We've had recent studies that show this, and we have to look at these studies and trust these studies and let science lead the way.
So, Doctor, more and more COVID-19 survivors are being called long haulers. For our viewers who aren't familiar with this, what does that mean, and what are the kinds of symptoms these people are experiencing, even after they're no longer testing positive?
Right, that's a great question. This is something that we're seeing more and more throughout the country now. These are people that have, had the illness. It may last a few weeks, but then they continue to have symptoms, coughing, shortness of breath. But the biggest symptom is fatigue, just no energy. And this can go on for months and months. And this is what defines the long COVID or the long-term effects of symptoms. People can't get back to work, they can't go to school, they can't function. And the medical community at this point has looked at these patients, and we've said basically that we have to take them seriously. The initial thought was that they were getting better, but for some reason they're not, and it could be an immunologic effect. But the big picture is that we have to invest resources and really take the time to listen to patients and validate their concerns and understand how serious this is.
Absolutely. And doctor, speaking of serious, we are in the middle of September with flu season right around the corner. Doctors are, of course, worried about a so-called twin-demic at hospitals, fighting the flu and COVID at the same time. Of course, every year, doctors encourage people to get their flu shot. But is it even more crucial this year?
Absolutely. Whatever we can do to basically to reduce the burden of illness and overcrowding in emergency departments as a result of the flu would allow us to better and more effectively care for patients with COVID. So obviously, if you get the flu and you have had the shot, the intensity of the illness will be less. And that's the reason to get the shot. We recommend vaccinating in October, ideally. The CDC says that the immunologic effect, that the protection lasts for about a year, but ultimately, the biggest bang for the buck is in the first 6 months, and that's when you get the most protection. So we advise you to get it in October to have a little bit more protection up until May, which is important to know that the flu season doesn't just last from December through January and February, but up until even April and May.
Right. So is your hospital then preparing for another surge like New York City saw back in March? I mean, I live near Lenox Hill. I saw the way, it affected the hospital. Are you expecting something like that again? And could the hospital even handle that high spike in cases?
Absolutely. We can handle it, and we're prepared, and we're ready for it. But we're hoping that we don't get this second wave. One positive is that if we look to the Southern Hemisphere, specifically in Australia, they had significantly less flu in their season, almost 99% less, because of robust vaccinations and public health outreach. And that may be a telling sign for us. If we can look to them and continue wearing masks, especially as we're doing, the intensity of the flu may allow us to more effectively reduce that burden and then more effectively care for people with COVID when they come in. But let's face it, let's hope that this second wave is not intense as what we faced in March and April for all of us.
Let's hope. Get that flu shot, wear that mask, and keep your distance. All right, Dr. Robert Glatter, thank you so much for joining us.
My pleasure.